Hi, it's me again, Dr. Mattia Briesman, and I wanted to talk about something that came up in treatment this week. It was interesting. It was two different people. Both had gotten off track a little bit because they became very, very sick over the holidays, and it extended into January. And somehow they got really, really off track, and we were emailing back and forth, and I just wasn't able to get them rebalanced after. And these are patients that have been under my care for years and have been better with their bladders. And recently they started to get flares, and I said, well, that's weird, why would that happen? And let's talk. So a big part of the job of any Chinese medicine doctor is being a detective. So I asked all the obvious questions through emails, thought I could make it quick, and I wasn't getting my answers. Diet, are you drinking over the holidays, sugar, all the normal stuff. No, and no new furniture, no new renovations, nothing that would have really interrupted their lives or affected them in any way. So I'm talking. It was actually very interesting because it was two different cases. And one kept saying, no, there's nothing different. And I said, well, what are you putting on your skin? What are you using in your hair? She said, no, it's just like all natural stuff. How long have you been using this all natural stuff? Oh, like the last 6 weeks. Can you tell me the name of it so I can look it up? And it's this brand, and it's natural, it's organic. So I said, well, let me Google. So I looked it up as we were speaking, and I looked at it and I said, are you kidding me? This is crap. This stuff is crap. It might be marketed as natural. It might be marketed as, yeah, it's really great. But I'm going to tell you that it's crap, and I wouldn't put it on my skin or my hair. And in any case, that was one case, and that was the culprit. The other case was a patient who's been under my care, and she's been great, got completely off track, like I said, and we went over the same things I just said. Diet, everything's great, nothing different. And she kept talking about these bars she was eating a lot of, and I'm like focusing on the bars, and I said, well, like maybe, but I don't think so. These seem pretty healthy, seem pretty benign, everything's fine. And then she goes, yeah, when I was sick, all I was eating was the normal stuff, like these tortillas I'm always eating. And I said, okay, well, those tortillas should be fine, but you know what, just let me take a look. And when I took a look, I was actually really, really surprised, because those tortillas, the second ingredient is what? Coconut oil. And coconut oil, I know this is not popular belief, and everybody thinks I'm crazy and everybody thinks I'm cuckoo, but coconut oil is not what it's cracked up to be. And for people who have had IC, it's death to the bladder. So does it mean you can never have it? No, it doesn't mean you can never have it. You definitely shouldn't be eating it every day, and you definitely shouldn't be eating it multiple times a day. Not even if it's in something. If it's the second ingredient, I promise you, you're gonna have symptoms. Whether it's today, tomorrow, a week from now, 2 months from now, it's gonna happen. And this really, really aggravated this woman's bladder to the point where she had blood in her urine. And she thought she had a urinary tract infection, but she didn't have a urinary tract infection. And at first, obviously, I thought it was a urinary tract infection, not knowing this, and I started giving her herbs for it. It just made it worse. But when we started to uncover what the problem was and do repair work on the tissues in the body, the repair work from the coconut oil destroying the tissues, it is getting better now. So that's my takeaway. Coconut oil, no coconut oil, except for here and there, and no crappy skin products or hair products. It's real, you guys. So I try to teach this to everyone, and I know probably some people get tired of listening to these same things over and over again, but they're true, and that's why I keep saying them. At least they're true for the kinds of people that we treat here at ICAMA. And I'm just just going to leave it at that for today. And if you have any comments, any questions, please chime in.